continue. So let's continue with the primary casualty care, which is the second step of the emergency scene management. So previously on our the first video that I've recorded, no, so the last part was the those priorities, that we need focus on. What are those things that we need to check when we do the primary survey? Now, last one was actually making sure that we are able to uh, focus on or control severe bleeding. Okay, now if there is more than one casualty, so meaning dili lang kay isa, dili lang kay duha, or 3, 4, 5 or more, you should perform a primary survey on each one in turn. Okay, so tagsa-tagsaon yun na nimo, you need to do primary survey on each of those victims. And then you give life-saving first aid only. So whatever is the first aid that could save the victim's life on that actual situation, then you give it. If negative pulse, negative breathing, then you immediately proceed with CPR. If there is severe bleeding, then you immediately do control severe bleeding. If the patient is already in shock, then you do management for shock. Okay, you give life-saving first aid only. Now, the primary survey should be performed on the casualty in the position he or she has been found, unless it is impossible to do so. So, meaning, as much as possible, you avoid moving the victim every now and then, because there is a possibility that the spine may have been damaged or may have been injured. So if you move the patient, this could cause further injury to the victim. So if you could provide first aid on that same position that you found the victim, then you do so. But if you think that that position or that location of the victim is actually harmful to the victim and to you as the first aider, then you can always move the victim to a much safer area. Okay, so that is for primary casualty care. Now, when we talk of unresponsive victim, unresponsive meaning when you check for responsiveness, no, you pinch the ears, you check on the feet, no, you swipe the nimo, no response. Then immediately do your ABCDs. Okay, A, open the airway, no, head tilt, chin left, jaw thrust. Make sure that the patient is able to breathe. Because there are times, guys, that when you open the airway, nakaginhawa, ning revive si patient. You already saw signs of life. Now, next is you check for the breathing. So breathing is actually checked for at least 10 seconds only. Look for the rise and fall of the chest. Listen for breath sound. Feel for the warm air and feel for the rise and fall of the chest, LLF. Okay, and then letter C, that is when you check for circulation. Check the pulse, check if the patient is pale, press on the nail beds. Okay, that is how you will be able to confirm if we do have a problem with circulation. Now, check for a carotid pulse. So, carotid pulse, this is the pulse that is located in the neck. So, guys, I want you to review the different pulse sites. Okay, that way, if the carotid pulse is actually not that audible, medyo hina, then you can always go on to the other pulse sites. Now, take note, if it's an infant or a baby, the brachial pulse is usually much audible. Mas klaro ang iyang brachial pulse compared to the carotid. Okay, now check for a carotid pulse. Now, if the pulse is absent, again, immediately start CPR. 1 cycle, 30 compressions, 2 rescue breath. Now, you at least in a minute, you're able to perform 100 chest compressions and 8 rescue breath. Okay, and then you stop after a minute, check on the pulse again, check for breathing again, check for signs of life. Okay, so you will know if there are already signs of life, then CPR is successful. You were able to revive the patient. If not, then you continue doing your CPR. Now, you also can check with deformities. check for open wounds, check for tenderness, check for swelling. What's the mnemonic? That's DOTS. Check for dots. Okay? So, check for deformities. Naglubag ba ang lawas? Nahiwi ba? Nakuan ba ang naong niya? Wala ba dili ba level ang iyahang face? Nag-drop ba ang other side of the face? It may be a sign that the patient may have stroke or the patient may have Bell's palsy. Diba? Are there open wounds? Check on the head, down, shoulders, down to the hips, down to the lower extremities. Check for swelling. Swollen ba yung mata? Okay. Is there swelling on the ear? Is there blood coming out from the ear? Okay. So, as you touch the head, is there a reaction? No? Can you see the pain on the, can you see the reaction of the patient's, or the victim's face? Klaro kaayo if there's pain. Okay? So, you also check for that. Now, you check for shock. How do you check for shock? The mnemonic is RPM. R for responsiveness, P for perfusion, M for mental status. Now, these are the three very important things that you need to check to confirm if the patient is in shock. Okay, so check for responsiveness. Check, check, tap, tap. Hello, ma'am. Are you okay? Responsive ba? Ning tubag ba? Ning reply ba? A simple nod in the head is already a sign that the patient is responsive. No? Movement of the arm or of the hand or the finger, it's also already a sign that the patient is responsive. Now, perfusion, that is when you do the capillary refill. Perfusion is actually checking the level of oxygen in the patient's body. Okay? Now, you will know if kulang siya sa oxygen if when you do the capillary refill test. Again, it's called capillary refill test. Okay? CRT, capillary refill test. So press on the nail bed. If the color of the nail bed turns back to its original color, which is pinkish or red, in less than 1 or 2 seconds, then we don't have a problem with perfusion. We don't have a problem with oxygen supply. But if it takes more than 2 seconds, no, for the color to be back to its red color or pinkish color, then we do have a problem with perfusion. Next, M is the mental status. So you check if the patient is confused. Now, how will you know? You ask for simple questions. What are these simple questions? You ask for the name. You ask for the date today. Do you know where you are right now? Okay. Do you know what happened? Okay. Do you still remember your relative's phone number? Okay. So those are just very simple questions. You can even ask for the birthday of the victim. Okay. So if the victim is able to respond properly, then we don't have a problem with the mental status. But if the patient was not able to answer those simple questions, possible that the victim is actually confused. Okay, so now I confusion sa victim. So we have a problem with mental status. Then if RPM is all positive, then the patient is in the state of shock. Okay? So, unsa kay makakause na nung magka-shock man si victim? Probably that there's severe bleeding. Okay? So, probably there's internal hemorrhage. That's why the patient is in shock. Okay. Now, so what do you do if you see that the patient is in the state of shock? Now, you check for severe bleeding. Immediately, if you see where the source of that severe bleeding, where is the wound and the body that has severe bleeding, or because you will know if there's internal bleeding because there might be blood coming out from the nose, coming out from the ears. Okay, so even diri sa mata makikita na nimo. So then once there's internal bleeding, then that is already an emergency situation. You need to immediately proceed with how to manage shock. Okay, now control bleeding. How do we control bleeding? You do compression. You use your bandage, you use whatever cloth is available that will help to put pressure over that wound and to control the bleeding. Now, elevation. Elevate the legs to aid with circulation para maka-circulate ang dugo. Now, determine the trigger pulse. Now, let's say for example, ani ni siya. What if ang wound niya, let's say for example, the wound is here in the area, so forearm. Now, this is your brachial pulse, right? Okay. Now, since there is a brachial pulse, make sure that you compress, no, on this part here. Hikta na nato tourniquet. Kay para, unsa man, para di mo grabe ang bleeding. We are able to control that part because that's the pulse site. Kusog kaayo, there is an artery there that was actually damaged. That's why there's severe bleeding. So if we are able to compress on that side, we apply tourniquet, hikta na nato, then we are able to control the bleeding. Okay? Now, give first aid for life-threatening ABC emergencies. Okay? Give first aid for life-threatening situation. So, unsa man to? Severe bleeding, if the patient is in shock, and if the patient is unresponsive. Three major priorities. Unresponsive patient, those with negative pulse, negative breathing, those patients who are in shock, and those patients who have severe bleeding. These are the top three priorities when it comes to giving first aid. Okay, so let's move on to the next slide. All right, so we are already done with the primary survey. Once you're done with the primary survey and you are still waiting for the medical team to arrive, wala pa naabot na traffic, then you immediately move on with the next step, which is the secondary casualty survey. Now, what are the things that you will do, no, on the secondary casualty survey? There, you need to do rapid body survey, head to toe sweep, head to toe sweep. Di ba ganina we did check for deformities, no, sa tanang parts of the body. We check for wound, but on the secondary survey, you need to check it again. Rapid lang. Imuha lang na siyang ikuan. Again, you check for other parts of the body that's bleeding. You check for lumps. No? Are there parts that's hard to move? Are there bruises all over the body? Is there tenderness in the body? So these are the things that you need to check again. And then you watch for the face or the person's face or the reaction of the victim himself as you do check, as you do rapid swiping of the body. That's rapid, ha, because nanuman, paspas na siya, you might be sued for harassment kung magdugay ka on a certain part of the body. Okay, start from the head and then move down to the toes. Don't move the casualty unless there is danger. Again, avoid moving the casualty to avoid giving further injury. Okay, but if that area or the position of the victim is dangerous or could cause further harm to the victim or to you as the rescuer, then you can always move the casualty. Okay, now never step over the casualty. Do not, ayaw tamaki. Okay, ayaw, make sure, be careful. Treat the casualty with care. And then when it comes to doing the secondary survey or the secondary casualty care, it has to be done in less than 30 seconds. Again, this is done fast. Done fast. Anyway, there is a video that I'll be sending you and you will know how it is done, how fast it is. No nga buhaton ninyo si secondary casualty care. Secondary survey. Okay? So, now give first aid for injuries found. Give first aid for whatever is the injury that you found. Kung naay sama diri sa head, top of the head, you do bandaging. Okay, and then you position. What should be the proper position of the victim? Recovery position. That way, okay ang ginhawa. Now you cover. Again, we still need to respect the patient's body. Ayaw na ibuyang niyang tibok niyang lawas, no? So you cover those parts of the body that needs to be covered, and you expose only the part that needs to be exposed. Okay, now there are 4 R's when it comes to the secondary casualty survey. When doing the secondary casualty survey, reassure, reassess, ABCs, you record, and you report what happened. Okay, these are the 4 R's sa secondary casualty survey nato. Okay, reassure, reassess, record, and report. Right? So, it's also very important that you need to maintain warmth. Okay, maintain the body temperature of the victim. Okay. On our next video, we will then continue with secondary casualty survey.